Good evening and welcome to another edition of the COVID-19 Pandemic Update on Channels Television in collaboration with the Ford Foundation. I'm Millicent Walker. Here are some of the highlights this hour. Today, more high-profile Nigerians contract COVID-19. The latest, Delta State Governor and his wife test positive. Activities resume in motor parks in Kaduna and Anambra states. National Human Rights caution against infringement of human rights. And United States obtain almost all the world's upcoming supply of COVID-19 treatment drug, remdesivir. There are over 400,000 confirmed COVID-19 cases on the African continent, with more than 190,000 recoveries and 10,000 deaths. From the Nigeria Center for Disease Control, NCDC, the country recorded 561 new COVID-19 cases in 18 states across the country and the FCT. 17 deaths were confirmed in 24 hours, one each in Lagos, the FCT, Kano, Ogun, Katsina, Plateau, Imo, Kebbi, while Bayelsa State recorded 2 deaths, Edo 3, and Niger State 4 deaths. The death toll stands at 590, as you can see on your screen. The total confirmed infection stands at 25,694, but almost 10,000 patients have recovered. States with the highest cases in each of the 6 zones are Lagos in the southwest with 10,510 cases. The FCT in the north central has 1,870, Kano's next in the northwest. Once more, Edo State overtakes Rivers in the south-south with 1,105 cases. Gombe and Bauchi now lead in the northeast, each with 503 cases, and Ebonyi tops the southeast with 438 cases. Now, community transmission is when there is no clear source of origin of the infection in a new community. It happens when you can no longer identify who became infected after being exposed to someone who, well, interacted with people from the originally infected communities. For example, a community spread in Oyo State means that cases are occurring in people who did not have any known contact with others from known hotspots like Lagos, the epicenter, or the FCT, second highest, or perhaps people who even traveled to the United States or even Brazil. Let's begin. Just before the ease of lockdown, the average number of daily confirmed cases was around 100 and 150 cases. But in the last couple of weeks, we've seen daily cases, and this has risen drastically. If you look at the update on cases, we're looking at Nigeria's figures with the confirmed cases, those that are on admission, those are the active cases. We're looking at those that have been discharged and comparing that to what you have in Lagos as the epicenter of the disease. So far, Nigeria has tested over 138,462 samples have been taken across the states, 35 states, including the FCT. And Lagos has tested a higher number from that particular pool with its testing capacity that is hoping to boost. The next slide shows us that the curve is not being flattened. We're looking at cases that we've seen from May the 6th, the weekly rise in cases, showing that the curve is still taking an upward turn. It's still rising, and perhaps, we do not know exactly when we will see a peak. We've heard from the Presidential Task Force on COVID-19 that for every 500 cases, they might have missed about 2,500. And this is the latest curve from May the 6th to the 1st of July as we know it. Comparing Nigeria to perhaps what we're seeing in other countries, we're looking at South Africa to the south. South Africa remains the country with the highest number of cases on the African continent, followed by Egypt. Nigeria is in 3rd place. We have Ghana also in West Africa. That's 1st and 2nd in the West African region. We have Cameroon, Central Africa as number 5 there with the number of cases at 12,592. And then we have Algeria, Morocco, both at the eastern and northeastern part of Africa. We're looking at over 400,000 cases. But the question really is being asked as to will Africa be the next epicenter? We definitely hope not. But what are we doing? Government efforts is really key to this. Lagos State is taking charge. They're ramping up efforts. They're introducing more private laboratories to its testing capacity. And it hopes to target 3,000 tests per day. And this is also hoping that it gets more PCR machines that it can use in its testing capacity. Why are we seeing more cases? Not a lot of people are complying to the rules. We're seeing more scaling up of testing capacity across the country. Some people are still doubting that there is a thing such as COVID-19. Most people still feel that perhaps it is a disease for the elites, and so they are in denial. But what must we do? The WHO is ringing out, and has indeed, times without number, told the world that prevention is key in this fight. And the standard protocols remain to wash your hands as regular as possible, coughing into your elbow, and not touching your face. Of course, when there's wearing your face mask, of course, staying 2 meters apart from the next person. And if you are sick, to protect those around you, you need to stay at home. We're going to be talking a lot more about how indeed these behaviors can affect and keep us safe as we fight COVID-19. Over in Lagos State, the government has unveiled 5,000 transistor radios for public school students to continue to have access to education. The e-learning devices were donated by the Committee of Wives of Lagos State officials with 5,000 face masks. This is as the government reiterates that testing for COVID-19 remains free for those that meet the case definition, as it enhances the capacity of laboratories to test all those who require testing free of charge.
What Council is donating this morning is to improve and enhance the learning capability of the children. And so we're indeed excited that they've been able to put this together for them. I hear that this is the first batch. Another batch will come in. So you know, this is the new norm. We need to adapt with the new reality of where we find ourselves. And so this is part of adaptability, and innovation has to come to learning. And so I want to commission this and put it to use with the benefit of all our children in the public schools. What we're doing now is, as much as possible, learning can be done, off-site. So it's just something for them to also get themselves busy, have a tool, have an app, have a phone, have a radio, whatever it means. You just need to use to communicate, right? Such that one has agreed time, in the comfort of your learning environment, you can tune, you can listen, you can take your notes, you can interact, you can be in tune. You understand? So this is reality.
So how best do we reinforce public health measures to achieve more results during the second phase of the ease of lockdown? Dr. Ejike Oji is the chairman, medical subcommittee of the FCT's Ministerial Expert Advisory Committee on COVID-19. He joins us from Abuja. We'd like to welcome you to the program. Dr. Oji, let's start with the updates from the nation's capital. Till date, the FCT has conducted over 17,000 tests and has about 1,267 active cases, but 33 persons have died. What are they doing right? What are they getting wrong?
Yeah, thank you, Millicent, for having me. One of the key things that I would say that happened in FCT in terms of fighting the disease was the wisdom of the minister to start to make sure that things are put in place, making sure there is an EOC with key pillars to fight the disease, but most also importantly, to invite other people to support the work that he is doing by setting up the FCT Ministerial Expert Advisory Committee on COVID-19, chaired by the former Minister of FCT, Dr. Aliyu Modibo. And within that key distance, we developed a project evaluation tool which focused on how do we make sure that we start preventive approaches, and then how do we make sure that we have enough treatment and isolation centers, And then also, how do we make sure that we train and equip healthcare workers who will be able to offer services to the community? And then that was the start of the work. And what happened that immediately treatment centers were ramped up from just 15 at the onset to about 1,030 as we speak. So, and then if you look at the redundancy here in Abuja, we still have about 80% redundancy in terms of bed space to be filled in case of a major trust or patients coming in. Because if you look at globally what is going on, the reasons why people were dying globally is that it caught some of the healthcare system caught them off guard. And what happens that there were more people who were so critically ill that the beds can be able to contain. A good example, in places like Italy and Spain, doctors had to make very difficult decisions of seeing two patients and deciding who they had to let go and the other one to save. So, and that's the critical element in this fight of this disease, to make sure that at any point in time, you are able to treat at least the very critically ill, even if you can't get all the asymptomatic ones in. And the next plank was to make sure that we ramped up testing ability within the FCT. The Health and Human Services made sure that after the first phase of the disease, we found out that most of the cases came from Wuse 2 and Maitama. And then eventually community testing was done, and then we found out there were a very high incidence of community infection in places like Mabushi, Gariki Village, Lube, and a few other places. So with that, it meant that the importance of the lockdown was so highlighted, because within that space of the lockdown, more testing was done, and then some community engagement was done, and to make sure that people are aware what they have to do and to protect themselves from the disease. So in terms of that, I'll say that FCT has done quite well. If you look at the testing per capita in Nigeria, FCT is number one. FCT has tested more people per capita than any other state. And this FCT has more bed spaces than any other state. So the areas that I would say that we need a lot of room for improvement in the room of engaging the community. There must be proper community engagement and then public education. And then the minister is well aware of that. Just today, he inaugurated an ad hoc committee of the new normal, which is a relationship between the National Orientation Agency, the FCT Situation Room Management, the Director of Press in the ministry, and then also our committee, the Ministerial Expert Committee. Just today, and what we're going to be focusing on in this is to make sure that we take in do a proper situational analysis to know why people are not obeying the clear instructions of the PTF. Because if you look at actually what is going on, unless people understand the philosophy of the disease and the philosophy of fighting the disease, because the four key things people must take away is that this disease is new. Nobody will say that I know this disease. Say I don't know it. Second one is that there is some science around it. So it's not that people are completely blind. And then common sense, the use of common sense, adding into the science that you already know to fight the disease. But above all, protect yourself. And that's why it's important for people who are above 50 to wear surgical medical masks anytime they are outside their domain. And then,
as if they must actually
one of
go
the key
out.
things that we're looking at is the super spreaders.
We'd like to thank you, Dr. Ejike Orji, Chairman, Medical Subcommittee of the FCT's Ministerial Expert Advisory Committee on COVID-19. Thank you for your insight and enlightenment on this issue.
Thank you very much.
Now, more high-profile Nigerians are contracting the coronavirus, the latest being the governor of Delta State, Dr. Ifeanyi Okowa, and his wife, Edith Okowa. The governor announced this on his Twitter handle today, where he explained they are all well and remain in isolation while undergoing medical treatment. This is coming almost a week after his daughter tested positive for the virus. Only yesterday, Dr. Okowa's counterpart in Ondo State, Governor Rotimi Akeredolu, also announced on his Facebook page that he tested positive to COVID-19. Before these recent cases, the governors of Bauchi, Kaduna and Abia states also tested positive, while the Bauchi and Kaduna governors have since recovered. Abia State governor is undergoing treatment. Still to come on our COVID-19 update, what does travel look like following the ease of interstate ban? We look at the human rights dimension to the COVID-19 response. That's in a moment. We take you to Bauchi State, where our correspondent Hajar Aliyu sampled some opinions of residents on the modifications to the lockdown ease.
The federal government has set new guidelines for reopening of schools, but the Bauchi State government is yet to speak about measures put in place to ensure safe reopening. I am here with some residents of the state, Mr. Haruna Salisu and Mr. Isiaka Winti. Let me start with Mr. Haruna. What do you think about this new guidelines?
Well, I think the guidelines are okay, and the decision to open schools is also okay. But I have always faulted the federal government on some decisions taken during this COVID-19 period. You know, I've always argued that Nigeria claims to be a federal state, to be operating a federal system of government, whereby peculiarities of certain states will be considered before taking any decision. But unfortunately, these people are just sitting in Abuja and making laws or declaring something for everybody to follow, without looking at the peculiarities of this state and so on and so forth.
Okay, thank you, Mr. Haruna. He has just spoken about consultation. Mr. Isiaka Winti, do you have a contrary opinion?
Oh, actually, as you know, since the outbreak of this pandemic, states supposed to have examined or experienced how obedience in terms of compliance with the safety measures. So it's high time, as for me, for the state governments to open the school in full, because I actually don't believe with what federal government says it's only graduating students should resume to school. If face mask is working and if the safety measures are clearly tested to be working, I don't think some selected students should be also should only be considered in the resuming of the schools.
Okay, thank you, Mr. Isiaka Winti. There you have it from Bauchi State, Hajara Aliyu for COVID-19 updates.
Motor parks in Kaduna Metropolis are back to life following the lifting of the ban on interstate travel imposed by federal government in order to curtail the spread of COVID-19. Recall that motor parks were closed since March 26 due to the state government's restrictions, except those on essential duties. Our correspondent spoke to some of the transport workers affecting the safety guidelines and what the new normal looks like for travellers and other business activities. It's also similar to in Awka, the Anambra State capital. It was relief for the transport operators as transportation activities commenced, but with strict compliance to the COVID-19 protocol seen among commuters and operators. According to the managing director of the state's transport company, the state government has handed out circulars to transport companies on the modalities of operation within the period. And with the interstate travel opening up, state governments and their Ministry of Health leading the COVID-19 response at sub-national levels, how do we balance solving a public health emergency, COVID-19, and protecting the rights of people to movement and other rights under the African Charter of Human and People's Rights? We have the Director, Civil and Political Rights Department, National Human Rights Commission, NHRC, Dr. Abdurrahman Yakubu. He joins us from Abuja studios. Welcome to the program. I'd like to begin with asking how different is the dimension of upholding the human rights of people under a pandemic such as COVID-19?
Thank you very much. It's quite very important. It's quite very important that whatever government does has to be in line with the Constitution and also Nigeria's human rights obligations. Under our Constitution, it is the primary responsibility of government, particularly under Section 14, where it says that the security and welfare of the people is the primary responsibility of government. And also in Chapter 4 of the Constitution, there are various sections that provides for different fundamental rights. Therefore, it is very important that whatever government does in terms of preventing the spread of the coronavirus, and also in terms of ensuring that those that are infected are properly taken care of, as well as all the measures, the safety preventive measures put together by government, both at the state and federal level, all these have to be within the ambit of the provisions of the fundamental human rights as guaranteed in the Constitution and in the extant laws of the country.
So, Dr. Yakubu, with the resumption of interstate travel, would it be infringing on one's rights to movement if a state COVID-19 task force quarantines a person whose temperature is above the 38 degrees and shows symptoms of COVID-19?
We cannot say that restrictions on travels is a violation of right to freedom of movement. Yes, people have the right to move freely, but this right is a right that can be restricted because in Section 45 of the Constitution, the section provides that the government, both at the state and at the federal level, can restrict certain rights for the purpose of defense, for the purpose of public safety, for the purpose of public morality, for the purpose of public order, and for the purpose of public health, and also for the protection of the human rights of other people. So what the government is doing is to ensure that in as much as right to freedom of movement is respected, but these should not in any way hamper public safety, public health, public order, and public morality. And as we know, this is a global pandemic, and the cases, keep on increasing in Nigeria by the day. Therefore, government has the moral and the legal obligation to prevent this pandemic. And one of the ways by which this can be prevented is to place some restrictions on travels, and also to put in place certain preventive measures, such as trying to measure temperature to ensure that those that have this high temperature do not enter public transport. So
we'd like to thank you.
The health.
We appreciate your time on the program. Dr. Abdurrahman Yakubu, Director Civil and Political Rights Department with the NHRC. Thank you for joining us on the program.
Thank you. It's my pleasure.
Now, as many countries around the globe race to find a permanent solution to the pandemic, the U.S. has secured almost all the world's upcoming supply of the drug remdesivir. It's the first to be approved by authorities in the U.S. to be used to treat COVID-19 and has shown to help people recover faster from the disease.
The United States says it has struck an amazing deal with the firm Gilead Sciences, makers of the drug remdesivir, that's been approved by authorities to be used to treat. A statement from the Department of Health and Human Services says the Trump administration has secured almost all the world's upcoming supply, buying 500,000 doses, which amounts to 100% of Gilead's production in July, 90% of it in August, and 90% in September.
The availability of what's known as therapeutics or medicines to treat people that have contracted the coronavirus and are experiencing severe symptoms. Dr. Steve Hahn of the FDA is here, and he will speak about the progress that we are making, whether it be the availability of remdesivir, which we're distributing another tranche this week, the use of blood plasma, steroid treatments, and also we continue to hear very hopeful signs about the continuing progress toward developing a vaccine for the American people.
In Colombia, the capital will not be going back into strict quarantine after the city received respirators to increase hospital capability to attend to COVID-19 patients. Bogota Mayor Claudia Lopez had warned that the city could be placed under strict quarantine if Colombia's government did not give the district at least 200 ventilators by July 1st, sparking off a storm of controversy with Ivan Duque's government.
And CDC continues to work closely with states. You can find the latest national strategy to scale up access to coronavirus disease testing in Nigeria and other public health advisory. A live feed of the World Health Organization's website has regular updates about the spread of the pandemic, the global COVID-19 strategy guiding the public health response at all levels, and there are practical guidance for action. Our website, channeltv.com, has indeed more updates on the stories. You can see there the latest on the pandemic and other stories from Africa and the world. That's our COVID-19 special edition on Channels Television in collaboration with the Ford Foundation. Thank you for watching. I'm Millicent Walker. Stay safe.